All right, welcome back everybody to the brain injury discussion. This is your host Jay. Today we are going to be talking about brain injury sequelae, also known as the after effects of brain injury. Like always, sources will be in the description below. We'd appreciate it if you check those out. We'd also appreciate some feedback, either in the form of a comment or a thumbs up on this video. We'd also appreciate if you subscribe to the channel. We put out informative, but also educational, but really applicable videos. We try to do that every week so that way we can make sure that we equip the brain injury community as well as brain injury survivors and brain injury personnel, professionals, and families that they might have a better understanding of brain injury. But like always, we have a lot to get into, so let's get into this. So you probably heard me use the word sequela before, and it is a Latin word, but generally speaking, the definition is a condition which makes, it's a consequence of a disease process or an injury or a secondary result of a disease or an injury. But realistically speaking, when we break it down, it really is what comes after the injury. And so in our world, in the brain injury world, we might see a variety of this. And this is just a brief overview of what could happen in the world of someone who might have a brain injury. And this word, sequela, has a Latin base of sequel, which is where we get the word sequel. Think about part two of a movie, part two of a series. Think about sequels. Really, we're talking about the next chapter. And I think that's something we should definitely consider, especially if we're working with people with brain injury. But with that being said, that is sequelae. So when you hear me say that, we're talking about the after effects. But we have a lot more to get into, so let's get into it. So, general brain injury sequela. There's a lot that we can cover here, and we're going to go into a little bit deeper detail. This is still a general overview, but what we might see with brain injuries, we might see seizures. That could be caused by a traumatic or non-traumatic brain injury. We might also see swelling. Obviously, if something's injured, I mean, if you see that bruise after you fall out of the tree when you're 6 years old, see that bruise and that swelling, it's the blood and it's the nutrients and everything going to the area of injury. We might see a neurovascular injury, which changes the blood flow of materials like oxygen, glucose to the brain. We might also see spasticity. Think about someone who's spastic, or think about a muscle spasm. That can happen after a brain injury and because of a brain injury. We'll also touch on mental health disorders. You might also see post traumatic stress. You might also see infections. Infections, a good example of this is that if you have a shunt, which is an ability to release pressure in the brain from buildup of cerebral spinal fluid. If that's not well taken care of, it can become infected. And so those are things that we need to be aware of in the brain injury community, especially for professionals working with survivors of brain injury. But we got a lot to go over, but these are some of the examples. And this is stuff that we have to plan and prepare for. But let's go deeper into this. Let's talk about cognitive brain sequela. This is probably going to be a big focus in the brain injury world because we do see this. We do understand this better than others, parts of sequela. And we tend to see this actively when we work with brain injury survivors. We might see slowed responses. Maybe uh, instead of going at the full 55 miles an hour, the brain is going maybe 45. Maybe it takes them a couple of seconds to, respond to a question. Maybe it takes them a couple of seconds to think about their answer. Again, that's why we need to understand the person. We need to be very patient with brain injury survivors. We might see that increased processing time. So if I were to give a brain injury survivor 2 plus 2, I would automatically say 4, but they might have to do the processing to come up with the answer. And so we might see the increased processing time. So keep in mind that the brain is the command and control center of the body. If you hurt one knee, that knee is going to be hurt, but it doesn't affect the other knee. It doesn't affect your arms. But if you injure your brain, you're affecting the whole body. So think of the brain as the command and control center for the body. Also, we might see memory gaps, especially when someone has amnesia or a loss of consciousness. especially if they had a severe blow to the head. And so they might have to fill in those gaps. We call that discombobulation. Maybe they're thinking about one thing because they're filling in the gaps. Maybe they're saying that their grandfather was in the Navy, but really he was in the Army because maybe they saw a Navy ship in his room or maybe in his office somewhere. Maybe they're filling in the gaps. And so another reason to be patient with brain injury survivors is they're trying to piece together information where there might be gaps in those informations. There might be holes there that they're trying to fill. We might also see task performance decrease. Think about someone who types 60 words a minute, and then after a brain injury, maybe they only type 15 words a minute. That might affect their job, that might affect their lifestyle, that might affect how they interact with others. That might affect a lot of things in their life. And that's just one example. Think about someone who worked on cars for so many years and knows how to change an oil, but then they get a brain injury, then they have to relearn how to do that. Yes, I need to put it in a safe position, put the vehicle in park. That's stuff that might be subconscious, but after a brain injury, they might actually have to think about that before they do so. We might also see decreased attention span. So, someone who used to sit through a 30-minute class maybe now gets a little bit jittery after 15 minutes. Maybe they see squirrel. Maybe they start seeing those things and maybe they don't retain the full 30 minutes of that class. That's just one example. That's why we need to be understanding of brain injury, especially if you're in the teaching profession. We might also see reduced executive functioning. Maybe they become more impulsive. Maybe they're not making the same decisions as they were prior to brain injury. And that's why we need to be considerate of these kind of functions that the brain plays before and also after the brain injury. We can't expect someone to be totally the same after the command and control center has an electrical short or a problem in there. Maybe that's been injured to the point where maybe it's not firing off the same. Think about a car engine with 8 cylinders. If two of the cylinders aren't firing, that car is going to feel very different than what 8 cylinders firing would be would be driving. So that's the kind of things we need to consider in this brain injury case management world. If you work with those with brain injury, or maybe your family with someone who has a brain injury. And so that's why I'm going to stress understanding is probably your best thing when it comes to the after effects of brain injury. But there's even more, and we need to consider. So let's consider the neurobehavioral sequela. This might not necessarily be very apparent at first, but it could be. Again, these sequela typically ranges quite widely. And so with neurobehavioral sequela, because again, the brain is the command center of the body. Again, that's where the emotions, the feelings, and also the facts are. But we might see that after a brain injury, maybe someone's personality changes. Maybe they were outgoing prior to that injury, but now they're more reserved. Now they're starting to become reclusive. Maybe they were involved in their community prior to the brain injury, and now they're kind of just staying home. That's a personality change that could happen from a brain injury. Or maybe they become more impulsive. Maybe they come up and maybe they think something's wrong with their car and they impulsively buy another one. Again, impulsivity, that's dysfunction from the executive function. And so what we find is that yes, impulsivity can be a sequela of brain injury. Also, kind of their mood. They might become more irritable, or maybe they become irritable a lot quicker. We tend to see a shortened temper, right? Someone's fuse prior to a brain injury might have been a little bit longer. Maybe they were able to tolerate maybe some uncomfortable situations, but maybe after that brain injury, maybe their fuse is a lot shorter. Maybe they need that little mental and physical time out before they go into a room with a lot of people. Maybe they need that area of non-stimulation to kind of reset. We don't want people to, burn up all their fuses. An instructor who taught me how to work with brain injury said, know your buttons. All right. We don't want people to press their buttons, but we also got to be careful about, yes, we want to take care of these people, but we also got to be considerate that maybe they need that quiet space. Maybe they need away from the anger or the things that disrupt their temper, or maybe start burning that fuse out. Also, we might see with the shortened fuse, we might see an increase in aggression or anger. Maybe they're angry about that brain injury. Maybe they're aggressive because their sympathetic nervous system with the fight or flight response is overpowering the other kinds of systems like the parasympathetic nervous system, which is rest and digest. But maybe their fight or flight response is kicking in because of that short fuse. Who knows? This could be a possibility with a brain injury survivor. This could have been caused by that brain injury. We might also see some more disinhibition, like increased talking or speaking, and maybe they're not receiving those verbal and nonverbal cues. Maybe they're not hearing them, maybe they're not seeing them, maybe they're not noticing them. That is quite common with brain injury. We need to be understanding that, maybe they are all these things. Maybe they're having a little bit of this thing, maybe they're having some of them. And so we need to be able to understand why this is happening. Not necessarily that it is just happening, but understand that this could have been caused by that brain injury. This could have been caused by that blow on the head. But there's even more we need to continue. Neuropsychological sequelae. Again, psychology is about the brain. And so, what we might see, and again, in extreme cases, delirium or dementia. Again, some hits do affect the ability to think. Maybe they're seeing things that aren't there, and maybe it's their eyes telling their brain that, yes, this is the information I'm giving you, and the brain is filling in the gaps. Maybe they can't see that. Maybe they're pulling things together, putting the puzzle together. Maybe they're trying to fill in the missing gaps. Again, that could be delirium or dementia in extreme cases. And the same thing goes with mania and psychosis, where you see that psychological breakdown after a brain injury. Maybe the brain chemistry is affected after a brain injury, especially if it is a severe blow to the head. We might also see, in maybe less severe cases, apathy. Maybe they're apathetic to what's going around them. We might see separation disorders. Maybe they start becoming more reclusive, which again, we want people to be involved into the community. Being social is part of the human experience. It's also good for someone's health, not just physical, but also mental health. Again, kind of disinhibiting. Maybe their non-social behaviors are showing. Maybe they're disinhibited. So maybe they're cursing out in public. Maybe something like that could be disinhibiting. We got to be careful about how we interact with people with brain injury because we need to understand that maybe the things they do, which push our buttons, maybe it's because they are disinhibiting. Maybe it is because of their brain injury. We need to be careful about that. We need to understand that and, of course, correct it accordingly. We might also see depressive and anxiety disorders that come from a brain injury. Maybe their brain is, again, having that chemical disbalance. Maybe they're not getting the same serotonin, or maybe it's an after effect of what they can or cannot do after a brain injury. Maybe they're not going outside because the light is too hard. Maybe they're not going out to social events. That could lead to depressive and anxiety disorders, but also the brain chemistry as well. And so, again, this is stuff that I would consult a medical doctor about, but uh, a lot of this is very connected to the brain. Also, for those of younger ages, we might see a stunted development. If you get a brain injury while the brain is still developing, so we're talking from birth or even before birth to age roughly 25, if we see an injury within those years, you might see a stunted development. Think about childhood or school sports and how far that has come. Think about instead of doing tackle football at 8 to 10 years old, maybe start doing tackle football later on or improve the protection, especially for younger ages. That's why it's important to keep this in mind, especially for the youth, even young adults. And I'm going to pull one from my experience, the military. The brain is not fully developed until in the mid 20s for males. And so a lot of the military are young males in their early 20s or maybe late teens. And so getting an injury, especially an explosion or maybe a blast injury, that can be very detrimental at that age when the brain is still finishing development. So again, that stunted development can happen, especially with younger brains. But what does this leave me as the brain injury case manager to conclude? Well, after a brain injury, things can change, and we see the sequela from those changes. Those changes are the sequela. That's the diagnosis from the diagnosis. These changes can be way more than just physical. Again, someone has a limp in their knee. Okay, it's not going to spread to their left shoulder. But with the brain being the command and control center of the body, we're more likely to see that this affects the whole body, including their whole life. And so we need to be understanding of that. These changes could be cognitive, behavioral, or psychological. We need to keep that in mind that this isn't just about how someone thinks, but also how someone feels, also how someone interacts and interacts with others and the world around them. But most importantly, we should observe and look for those kind of changes. Again, kind of the preparedness talk. We need to be prepared for this. It's important to know these people and get to know them and also know their buttons and know their fuses. That way, when you're dealing and working with people with brain injury, you can address these things accordingly with understanding in that person-centered model. We want to be unique to them. We want to customize and make ourselves good for the person, not for a medical system. And that takes a lot of understanding. But with that being said, I think I will end it here. I hope everyone has a wonderful day. Here are my references. I'd encourage you to read those. They're always good, scientifically backed. And we'd appreciate some feedback in the form of a comment, maybe a like, and also we'd appreciate if you subscribe to this channel. But with that being said, I hope everyone has an absolutely wonderful day, and don't forget, protect those brains.